So in this video, I'm gonna share 3 news articles that I found interesting between January 3rd to January 9th of 2021. So I've been wanting to do a weekly news series for a while now. I think I started one a couple years ago, but I never kept up with it. But there's so much information that goes on there, and I figured, I read articles to keep up with the times, so why not read and also share? In particular, I like to read articles that span pharmacy, informatics, infectious disease, and public health and policy. So I look at usually ASHP Daily Briefing, AMIA Daily Download, different social media networks, and just different areas that I may be subscribed to or word of mouth. And I figured I try my best to share the most newsworthy articles every week. So the way I'm gonna do this every week is I'm gonna show a preview of all the different things I'm gonna talk about, which you should see right now. And then I'm gonna go through and talk about each one of them individually. At the very end, give a reflection, a very short one, on what comes to mind. So it's kind of like me reacting to the news article. And that's kind of it. Should be short and sweet, just like myself. So the first news article here is that ASHP released a new COVID-19 vaccine security, storage, and handling resource. I'm just gonna read the description here. So, as part of ASHP's continuing work to support pharmacy professionals on the front lines of a historic mass immunization effort, ASHP has developed a new resource guide on the security, storage, and handling for the COVID-19 vaccines currently authorized by the Food and Drug Administration. This resource guide provides current information and guidance from ASHP and hospital and health system pharmacy practitioners on the security, storage, and handling for the COVID-19 vaccines. It incorporates information from the respective FDA emergency use authorization letters and healthcare provider fact sheets for the Pfizer, BioNTech, and Moderna COVID-19 vaccines, as well as general best practices for cold chain storage and monitoring, management of vaccines in preparation for administration, and safety and security measures for drugs prone to errors and mishandling, like temperature excursions or diversion. With pharmacists, pharmacy residents and students, pharmacy technicians, and many other healthcare professionals playing pivotal roles in the COVID-19 vaccine rollout, ASHP's new resource serves as a current reference document to support our members and other providers who are serving on front lines of the vaccine rollout. So this was released on January 7th, 2021 on a Thursday, and I found this on ASHP's Daily Briefing. So my thoughts here is that I completely echo the sentiments by ASHP. Those of us in the pharmacy profession play a key role in the success of the COVID-19 vaccine distribution. I think at a minimum, we should all know that this resource exists, and ideally, we should all be familiar with the contents of it so we can serve as a resource when folks have questions. So the second article here is ONC releases new resources for interoperability rules, a timeline of key compliance dates. The description is the HHS Office of the National Coordinator for Health IT on January 4th released new resources and guidelines for requirements related to its upcoming information blocking rules. Last March, HHS finalized 2 interoperability rules issued by ONC and CMS to support the My Healthy Data Initiative and 21st Century Cures Act. ONC's final rule establishes new regulations to prevent information blocking practices by providers, health IT developers, health information exchanges, and health information networks. The rule also aims to give patients more access to their health information via smartphone apps of their choice. And what I'm gonna do is I'm gonna link 2 things below, one to the news article, and the second thing to the actual HHS blog, which shows the entire timeline of when this is gonna occur. This, I mentioned earlier, occurred on January 4th, 2021, which was a Wednesday, and I found this off the AMIA Daily Download. And my thoughts here is, I may have mentioned it in some of the previous videos, but the 2 interoperability rules finalized by the ONC and CMS, in my opinion, are the largest and most significant pieces of regulation that are going to be impacting us in healthcare, especially in informatics, for the next, I don't know, decade. It's instrumental what these rules are gonna do. And maybe I'm a little biased here, and just for full transparency, I did participate in drafting the final parts of the ONC rule, in particular related to e-prescribing. But I do think that these are hugely significant, and that everyone in the informatics community, I encourage you to review them and check them out. The last article here is Amazon, Berkshire Hathaway, and JP Morgan end their healthcare venture, Haven. Here's a description. A healthcare venture launched with great fanfare by three of the world's most prominent companies, Amazon.com, Berkshire Hathaway, and JP Morgan Chase, and their chief executives, is folding about 3 years after its founding. Haven Health, sparked by an idea from JP Morgan chief executive Jamie Dimon and supported by Amazon's Jeff Bezos and Berkshire's Warren Buffett, sought to transform healthcare and reduce costs for hundreds of thousands of workers at three companies by pooling resources and technology. The joint venture, which was announced in 2018 with expectations high enough to push down major insurers' shares, will cease operations in February without having achieved those aims. Haven's transformative ambitions proved too difficult to achieve, according to people familiar with the matter. Its shutdown attests to the challenges of making sweeping changes to the US healthcare system and of bringing innovations to hundreds of thousands of employees around the country working at different companies, the people said. This was announced on January 4th, 2021 on a Monday, and I found this off the AMIA Daily Download. So my thoughts on this, and I've kind of shared this on some of my social media networks already, I think it's a fascinating but not really a surprising read. You know, there's many ambitious groups, in particular tech groups, that are trying to tackle some of these very complex healthcare problems. And my biased opinion is that many of these tech groups don't usually have the other resources that are required to tackling these problems. They're very heavy in tech. And I think that you need a combination of tech, healthcare practice, and public policy to be able to tackle, or at least begin to tackle, some of these problems. Obviously, I'm oversimplifying it right now, but in some of the things I've seen, it's always like very weighted towards one of these domains. And rarely do you see teams that have all three, or if they do, it's limited somewhere, and again, heavy in another one. And so most of the case, in most scenarios, I usually see it being very concentrated on the tech side. You gotta have the other components too. And of course, this is just my opinion. All right guys, so that's kind of it for this video. Hope you enjoyed it, and I'll see you all next week.